Good morning and welcome to the show. The topic today is Tennessee's war on drugs, and we're fortunate to have with us a member of Governor McWhirter's staff to talk about the question of a drug-free Tennessee. And let me introduce the audience this morning to Mr. MHerrmann. Mr. Herman is the coordinator of the governor's initiative for a drug-free Tennessee. Mr. Herman, I think that there's also an alliance in that name. Why don't you give us some information in reference to that organization and your part in that alliance?
Okay. Well, I'm the coordinator for the Governor's Alliance for a Drug-Free Tennessee. The program was started in '87 by the governor in an attempt to really bring Tennessee entirely into the struggle to deal with alcohol and drug abuse problems. Up until that time, there had been a number of kind of fragmented approaches to the problem. And the governor wanted to be sure that the full force of state government got behind this issue. So he created the Governor's Alliance for a Drug-Free Tennessee. Essentially, what the governor tried to do with the program was two broad things. One, to consolidate all the different programs of state government under one umbrella organization. There are something like 17 different state agencies that administer some type of alcohol and drug program. And governor wanted to be for sure that all those different state agencies were doing something effective, that weren't duplicating effort and stumbling all over ourselves. The second thing that we wanted to accomplish with the program was to bring the struggle to the community level. I think there's a very strong belief, not only of the governors, but of a number of people, that the problem just isn't going to be solved through government programs. If we're really going to address this issue, we're going to have to bring it to the community so that parents and kids and businesses, everybody's touched by the problem, and everybody's going to have to be involved in the solution. So what we've tried to do, in addition to coordinating state activities, is facilitate community involvement in the problem. So.
Now, when we talk about the drug problem in Tennessee, exactly what are we talking about? What is the extent of that problem? Do we stand near the bottom in terms of enforcement and dealing with it as a problem, or are we at the top, or where do we stand, and how widespread is drug abuse in the state of Tennessee?
Well, unfortunately, Tennessee is not immune to any of the problems of the states surrounding it, and what data we have been able to collect leads us to believe that we're pretty much in line with what's going on with the rest of the country. It's been estimated, the problem costs us $3 billion annually, is a primary factor in probably 65% of the crime, is responsible for all sorts of family disruptions, health care costs, you name it. It's clearly one of the most serious issues facing the state. In terms of how we're stacking up with other states in terms of addressing the problem, one interesting thing last year, we found that Tennessee led the country in the rate of alcohol-related arrests. We were second in the country when you brought in drug-related arrests. So one of the things that we feel like we really made some significant progress in is in the area of law enforcement, because we are, like I said, first and second in those two areas. So we've been moving along quite a bit with the problem. The other thing that we're trying to do is to get people to realize that alcohol and drug abuse doesn't occur in isolation, that there are all sorts of other interrelated problems that we need to be looking at the same time. Particularly with young people, the biggest issues facing kids are alcohol and drugs, teen pregnancy, teen suicide, and violent crime. All of those are interrelated. So hopefully some of the things that we're doing to try and address alcohol and drug abuse can also be helpful in addressing some of these other issues.
Now, the state sees alcohol abuse as part of the drug problem.
Right.
And
Right.
now, what are some of the other drugs that would fall under that kind of prescription?
Well, of course, we're concerned about illicit drugs, you know, marijuana, cocaine, crack. Also, too, we need to be very concerned about prescription drugs. In fact, in 1986, when we started the program, Tennessee was had one of the worst records in the country for prescription drug abuse. So we've been able to do some things, some joint activities with Prescription Drug Council to reduce prescription drug diversion, to reduce Medicaid fraud, to get us more back in line with the rest of the country in that respect.
When you talk about prescription drug abuse, why don't you give us a case scenario on some of the problems that we encounter? Because a lot of folks might be caught up in that kind of drug abuse without even knowing it.
Well, I guess we could really, there's 2 or 3 different scenarios. Yeah, you could have a scenario where maybe the drug is prescribed to you by a physician. Maybe you're not taking it the way you're supposed to be taking it. Maybe you're mixing it with alcohol or other drugs, and maybe fudging a little bit with the doctor about what you're telling him to continue getting this prescription. That's the most obvious thing. Also, too, though, you know, there are folks that will either forge prescriptions or find some other way other than a legitimate means of obtaining that prescription to then go and get these drugs, and they end up getting onto the illicit market. In the third arena, and is something that, again, I think we've been able to make some tremendous strides with, is, you know, within the healthcare profession, doctors, nurses, persons that are exposed to these drugs and have access to some pretty powerful drugs, you know, it gets to be a problem for them in terms of, you know, maybe they'll start out to, you know, take a little medication to relieve some stress, and before they know it, develop a real problem with it. So we've been able to get some things started in the healthcare arena to help doctors and nurses, you know, recognize if maybe they've got a problem or they have a peer that has a problem, and try to get them some help.
If you had to sort of list